As Ghana continues to battle COVID-19, there's concern that little attention is being paid to other ailments. That's not all. Many people are unwilling to go to the hospital for fear of contracting the virus. Considering this threat to public health, an MP has begun a program to ensure his constituents are in good health. Medina MP Francis Sossu launched the free screening program in the constituency, with the maiden edition set to begin on the 3rd of April, tomorrow. Now, joining me in the studio is Dr. Yenusom Malog. He's Head of Health Projects at the Office of the Member of Parliament, Medina constituency, and he joins me in the studio right now. Good to have you. So this project, tell me about it. What is it about?
Thank you very much, Aisha, for having me. So this medical outreach is actually amongst other projects that the Honorable MP for Medina constituency, Francis Xavier Sossu, has for the people of Medina in terms of health. The medical outreach is actually going to be held in 2 electoral areas tomorrow in the Medina constituency. That's the Pantine electoral area and the Nkontana electoral area. At Pantine electoral area, it will be at the Pantine Village Basic School. Okay. You know, and then at Nkontana electoral area, to be at Nkontana cluster of schools. Okay. So this is going to be something that is going to run regularly. So every quarter, we are going to have these outreaches. Okay. Yeah, so the health projects, the outreaches is part of the health projects.
What exactly do you seek to achieve with this project?
So we are targeting about 3,000 constituents to sort of provide this free medical care for them, you know, free medical that we are doing for them. You know, because there are some people who may have certain ailments, but they may not know. And at these medical outreaches, it's trying to bring it out. For example, you may not know you have high blood pressure unless through some of these screening programs. So you hear about it, you go and join it, participate in it, then we check, oh, your BP is high, okay, take a rest. After taking, we check again, oh, it's okay, because we'll be taking data of everybody who is coming. Then we refer it out, go to the nearest hospital for them to continue. Okay. The blood sugar test, same. For most people, they do not even know that they have got diabetes until just something incidental, then they check. Or you have a complication of it, you are rushed to the hospital, and that's when they realize that you have it. So this medical outreach is something which is really a very good initiative. And like I said, this is not the only thing that the Honorable MP has for his constituents in terms of health. There are so many other projects, I'm sure with time, as we have the conversation.
So what are those other projects? Tell me about
So the health projects under the office of the MP, which I'm leading, you know, we also have something we call the mobile clinics. We hope to establish these mobile clinics that would move from electoral area to electoral area. We are began talking to other partners about it. Have a vehicle stocked with medications. Then we agree on a schedule because we have 2 electoral areas in Medina. And then on a monthly basis or we schedule on a weekly basis, we go there for people who cannot afford. Okay. Or for people who, because of distance, you know, this all helps together for us to be able to achieve the universal health coverage that is part of the social development goals that we are all trying to achieve, you know. And where we say that nobody should have difficulty in accessing health care. Okay. Even if you don't have money.
So tomorrow's activity, where are the venues? I heard you mention some of them.
Yeah, so like I said, we are going to run it in 2 electoral areas in Medina constituency. Okay. The Pantine electoral area. And the venue is going to be the Pantine Village Basic School. Okay. And for the Nkontana electoral area, the venue is going to be the Nkontana cluster of schools. Okay. You know, and so many constituents have called that. So I'm staying at least in Medina Estate. So do you expect me to walk all the way to Pantine? I'm at Danfa. Just want to come all the way to, you know, Nkontana. Okay. It's a genuine concern, but we are going to get to everyone. Okay, so, I mean, once you're done with this tomorrow, you do another in other areas? So in the next quarter, we'll move on to other electoral areas.
Okay. Yes. Okay, so, and you talked about some of the services that will be rendered. They will do free testing, free screening for blood pressure, diabetes, and what other ailments? Yeah, so we will have the blood pressure test, or we will take your blood pressure, and of course be able to pick up if you have hypertension or that. So we also have blood sugar tests for diabetes.
We also have malaria tests. So, I mean, we have RDT test kits. Yeah, depending on your symptoms, we may request for that test to be done.
Okay.
And we also have, we check your weight, we check your height, and we'll be able to tell your body mass index and be able to advise appropriately whether you are overweight, normal weight, or you are obese. Then we also have free consultation. So after you've gone through these tests, there's a stand where you go and see a doctor who will then look at your test and then tell you,
and
advise you,
on what
and also
to
if
do.
you have some complaints, listen to you, advise you. And after that, the doctor will then prescribe. And the next stand, yes, is a medication. We are giving free medications.
Oh, wow.
Nobody's going to pay for anything.
All right. So we wish you all the best tomorrow. Dr. Yenusom Malog is Head of Health Projects at the Office of the Member of Parliament, Medina Constituency. Sossu. His first name is what? Sossu
Francis Xavier Sossu.
Francis Xavier Sossu.
Francis Xavier Sossu.
Who is the MP for the Medina constituency. I'm grateful for your time and wish you all the best as you begin this project to take care of human lives.